joining today. I am super excited on this episode of Changemakers of the Pandemic to be talking with Dr. Melissa Merrick from Prevent Child Abuse America. Dr. Merrick, thank you so much for being here. I'm super excited to learn more about the work that you're doing. Can you start by giving me an overview of Prevent Child Abuse America and what you've done in the last couple of months?
Sure. Well, first of all, thanks for inviting me today. I'm excited to join you all. And change makers like you really inspire me and remind me of the important work that we all have to do together for children and families. So, Prevent Child Abuse America is a national organization, the oldest national nonprofit dedicated to the primary prevention of child abuse and neglect. So, what we mean by that is we really try to stop child abuse and neglect before it occurs. So I think sometimes when people hear about child abuse and neglect, they go straight to things about treatment or early identification. And of course, that's super important. But we believe our role, and through our vast network of state chapters around the country and an evidence-based home visiting program called Healthy Families America, again, we are trying to set the foundation so that child abuse and neglect does not occur in the first place. Really related to the time that we find ourselves now, not only with a global pandemic that certainly in our lifetimes we've never seen anything like this before, but also, trying to exercise our First Amendment rights in a global pandemic also is really an unprecedented thing. So we know that this brings a lot of uncertainty, a lot of stress, anxiety, other things to our parents and to our communities. And we know that in any time like recessions or after a natural disaster like a hurricane or a tornado, we know that in anticipation of those events, as well as in the aftermath or recovery period of those events, that stress is super high. We know that there are things like financial insecurities and stressors, unemployment, unpaid leave, no access or difficult access to health care, these kinds of things that really increase parental stress and really increase risk for children for experiencing child abuse and neglect. So we knew in this moment, as we are all sheltering in place, we are seeing true public health in action. It doesn't work to stem the flow or to flatten the curve if one of us wears a mask, if not all of us are, right? Or if one of us shelters in place, but our neighbors don't. So this kind of collective approach that's needed in a health issue like coronavirus is also the same kind of public health, collective, together work to assure conditions in which children can be healthy and can thrive that is needed in child abuse and neglect prevention year round, but in particular right now.
Absolutely. And how is the problem of child abuse exacerbating? I know you touched on this a little bit, but how is it escalating during COVID-19, and what specifically are you doing to remedy that?
Yeah, so, there's a lot of reasons and a lot of unknowns too in this area, surveillance and kind of measuring child abuse and neglect, even in normal, quote unquote, situations is difficult, right? Our surveillance efforts and our measurement systems are imperfect. And our topic is one that, we know that it's a huge problem, but we only are able to measure the tip of the iceberg anytime because so much of child abuse really is maybe only known to the child and to whoever the perpetrator is. But we know, particularly in these times, again, of increased financial stress, uncertainty, housing, instability, economic insecurity, these are real risk factors for parents, just at their own, managing their own stress levels. And at the same time, we know that kids are not in school in the traditional way, right? They're not maybe going to their well visits with their pediatricians. We're not out in the community seeing each other, right? So kind of the unintended consequence of social distancing is that we're becoming socially disconnected. And that recipe is one that we know increases risk for children. So in this time of physical distancing, we know emotional and social connectedness is more important than ever. These are factors that help protect children and families year round, but in particular now. So one way that we've really pivoted our work is Healthy Families America is our evidence-based home visiting program. We visit with over 70,000 families every year in their homes. So obviously, we have had to turn almost entirely to virtual visits and phone call visits, things like that. But we've heard from families that it's so important and they feel so thankful to have this support continuing in this time. Because what evidence based home visiting does is it really helps families cope with trauma, right? And what we're all going through is, again, traumatic, no matter what community you live in. But certainly, we know that there are certain communities that experience a disproportionate amount of the burden of all of these risk factors for health and well-being. So we really believe that it's critically important that our work, again, to stay socially and emotionally connected to families is critically important. We've also been trying to, of course, send out resources to our networks, not just for parents, but also for policymakers, also for businesses, for children themselves, for families. So we just see this as our work is more important than ever.
And what was the process like for you to go from this very involved physical organization focused on community to all of a sudden being virtual? How did you make that pivot to adapt to COVID-19?
Yeah, kind of like every other organization, I think, and profession in this country. We've done it on the fly. We've really tried to recognize the critical importance, but we're making sure that our families have the resources. Have phones, have computer connectivity. We've been working with business and media partners to be able to make sure that we can get those resources out to families. But really, it's our workforce. Really, they don't see that this is a time that we can just not pivot. It was, we had no choice, right? And I think a lot of change happens organically like that, right? Where you see a problem and you need to continue to be a solution. And so you can't always just wait for perfect evidence or a perfect platform. You kind of have to be flexible and recognize that it could be that we're going in and out of connectivity. We might have internet issues, but we stay connected. It's just more important than ever. And that we also find, newer ways to connect, right? And in neighborhoods, people, are putting encouraging signs to children and families that might be walking by, checking in on neighbors in whatever way is safe and appropriate to do. I think it's, again, in this time of physical distancing, our emotional and social connectivity is more important than ever in any way that we're able to achieve it.
Definitely. So, what impact have you had on families and children? What type of testimonials are you receiving? And most importantly, how does that make you feel to see the organization touching so many lives?
Yeah, well, first of all, I'm a new leader here. I joined Prevent Child Abuse America as the president and CEO in July of last year, having spent many years working at the Centers for Disease Control and Prevention in Atlanta. But I came here because of the impact that this organization and our networks can have on children and families. Again, a statewide or a nationwide state chapter network that are doing important on the ground, boots on the ground work in communities. But also we, have a policy strategy and we have a communication strategy, and we kind of work across in a comprehensive way to address these important needs. So, I mean, what we hear from families in particular at this time of sheltering in place and not being with our normal kinds of supports is that Healthy Families America, home visitors and family support workers, and others in our organization are providing a lifeline for children and families, that they feel like they're able to stay connected and to get support and to recognize that they're not alone. Many of us, myself included, who are fortunate enough to be able to be working from home, to still be getting paid, to having our children be able to do their Zoom classes. My third grader and fifth grader are on a Zoom meeting right now. We are so fortunate, yet we are stressed out as parents, every moment of the day. And you feel like you're not bringing your best self to your work and to your family, right? And that is something that all parents are experiencing right now. So really just having that connectivity with a family support worker, a home visitor, others in their network, we're just hearing is so important for parents in this challenging time.
Definitely. And what role does collaboration play then? You've mentioned all the teams that are working together. So can you just touch on that?
For sure. I mean, I have to say that I believe that prevention can only happen in partnership. We have so much work to do, not just as an organization, not just as a field, but as a country, as a world, right? We all have a role to play in assuring health and well-being for children and families. I truly believe that. So that means working across all the lines that sometimes divide us, right? All of the professions, the perspectives, all of them hold value in this prevention business. So I really believe, staying connected and being innovative with change makers from all walks of life, of all age, of all gender, of all race is so important, but also of all profession, right? There's business leaders that need to be part of the solution of child abuse and neglect. There's policymakers, certainly media, right? How do we message this? It's not those families, it's all of us together wanting to assure health and well-being for children and families. So I really believe that change can only happen in partnership, just like prevention can only happen in partnership. So I'm really thankful to young people like you and others that can really be leaders in this work together in partnership with the many other leaders and champions for kids and families.
Definitely. I think teamwork is so important because it just amplifies the work that one person can do. Can you mention what advice would you give to young people who want to get involved and make an impact right now?
Well, I think you probably have more advice than me as a young person yourself. But I just think, not feeling limited by your age or your inexperience. There's so much to be learned from young people, the optimism, the innovation, the commitment, the passion. I think every generation wants healthier kids in the generation to follow, right? Because we want young people, the energy, the excitement, and really frankly the moment in your life that you're not yet totally jaded, right? Or you're not totally beat down, you feel like you can take on the world, and I believe that you can. And so we need young people to recognize the impacts and the voice, the really loud voice that you have. And I can assure you that people of my age or my um, uh, profession, we value you, we value partnering with you, partnerships with people of all ages. Again, no matter what you feel like you have to say, that we're listening, we are listening.
That's super powerful. Thank you so much for sharing and for all that you're doing for our community and young people during this time.
Absolutely, and thank you again for your passion and commitment.
Yeah, I really loved hearing your story. So thanks again for making the time to come on the podcast.
Absolutely, thanks for having me.